Welcome everyone again to the University of New Mexico Law and Mental Health Series, weekly discussions of practice and science featuring experts in behavioral health and the law. This series is run by the Division of Forensic Behavioral Sciences of the University of New Mexico's Department of Psychiatry and Behavioral Sciences in support with the New Mexico Behavioral Health Services Division. I'm Anthony Perillo, the Forensic Psychology Training Director here at the University of New Mexico. For our talk today, if you have any questions for our presenter, make sure you enter them in the Q&A box. You can enter those anytime you'd like, but do know that we hold questions until the end, and oftentimes it's not possible for us to get through all of them. If you are pursuing continuing medical education credits, there will be a sign-in sheet posted in the chat box shortly. If you're pursuing APA continuing education credits, the link for the survey that you would complete will also be in the chat box, but near the latter portions of the talk. Make sure that you save or bookmark that link if you're not going to open it during the webinar, and make sure you save your certificate after you complete the survey because we don't have access to copies of completed surveys after the fact. If you missed our most recent talk in the series, Dr. Terry Cooker's inspiring discussion of a relevancy-focused approach to forensic report writing is now available on our YouTube channel. The recording for this week will be available on our YouTube channel later this week, as well as PowerPoint slides for those that have registered for the series. As a heads up, next week we have Dr. Miguel Nunez and Dr. Andrea Musket, who will be discussing insights into violence risk assessment from a multidisciplinary treatment team perspective. But circling back to this week, I am thrilled to introduce you to today's speaker who will be discussing clinical and ethical considerations regarding empathy during forensic evaluations. We're talking today with Dr. Cassie Brown. Dr. Cassie Brown completed her Ph.D. in clinical psychology in 2022 through the California School of Professional Psychology at Alliant University in San Diego. She then completed her predoctoral internship at the California Department of State Hospitals, Metropolitan in Los Angeles County, where she completed primary rotations in neuropsychology and treatment for competency for male identifying individuals. She completed her dissertation on the topic of assessment of feigned traumatic brain injury during psychological evaluations. She then moved on to complete a Forensic Psychology Postdoctoral Fellowship here at the University of New Mexico School of Medicine, Department of Psychiatry and Behavioral Sciences. As her primary supervisor, I can attest that her clinical work was so strong, we were thrilled to successfully keep her here and hire her on as a research assistant professor in our Division of Forensic Behavioral Sciences, which she has been since September. Her clinical interests include trauma-informed care, forensic evaluation, and evaluation of treatment of serious mental illness. So, Dr. Brown, Cassie, on behalf of your institution, we are very excited to have you joining the series again, and thankful for you sharing your expertise with us today. I'll go ahead and toss it over to you.
Thank you, Dr. Perillo, so much for that wonderful introduction. I have loved getting to complete my postdoc here through UNM, and it's been a joy to stay on and get to work with you all. So I appreciate that. All right, let me go ahead and share my slides here with you all. Okay. Let me just turn this into presenter mode. Okay, so today we will be discussing, receptive and expressive empathy in forensic work, clinical and ethical considerations. So a brief bio that Dr. Perillo just kindly went over. These are some instructions echoing what Dr. Perillo went over, so how to receive continuing education credits. Just full disclosure, I don't have any financial arrangement related to the content of this activity. And the views expressed in this presentation are those of mine, and they don't necessarily represent the views, policies, and positions of the University of New Mexico. So our learning objectives for today, first of all, to be able to describe how receptive empathy experienced during clinical forensic work might affect a clinician. Secondly, to describe how expressing empathy during a forensic evaluation impacts the evaluator and their impressions. And third, to identify additional ethical considerations regarding expressions of empathy during forensic evaluations. So I'd like to start with the definition of empathy. I like this definition provided by Carl Rogers in 1975, where he says, empathy means entering the private perceptual world of the other and becoming thoroughly at home in it. It involves being sensitive, moment to the changing felt meanings which flow in this other person. So I want to just briefly go over receptive versus expressive empathy. I've given a very similar talk before where I just discussed expressive empathy, and this time I'm going to expand it to include receptive empathy and how that can also affect us and affect our work. So in brief, receptive empathy are the feelings, emotions, thoughts that we have where we perceive others' feelings, thoughts, and emotion, and we receive that and internalize it and feel it ourselves. Where expressive empathy are statements of empathy or body language or things that convey to another person that we identify and feel their thoughts and feelings as well. So first, I'm going to discuss the effects of receptive empathy on clinicians. So empathy is really crucial. Excuse me, I have some allergies, so my voice is a little off. So empathy is really crucial for clinicians in our work that we do with other people. It's that bridge that connects us to other people and really helps to foster the work that we do with the individuals that we work with. It's helpful for understanding other people's thoughts and feelings, other people's perspectives. It's also crucial for rapport building with the people that we work with. And when appropriate, so in the context of a psychotherapeutic relationship, for example, empathy helps us build that therapeutic alliance with other individuals. Now, I put this title here, Don't Take It Home, because that's something that I heard a lot throughout my career. And even before I started grad school, I did some work as a crisis intervention counselor for individuals who are experiencing family or intimate partner violence. And often the advice that was given to us at that agency, and then as I progressed through my career in the mental health field, I've heard people say, don't take these things home with you. Leave them at work. Leave your work at work. Well, that's really difficult to do, right? I mean, I respect the advice and I understand where it's coming from, but that can be quite difficult. We are human beings and we do hold on to thoughts and emotions and things that we experience in our day to day, especially when we are working with individuals who might be experiencing something heavy that can in turn affect us. So I wanted to discuss not only the benefits and what's crucial about empathy, but also the what can be difficult about those empathic feelings and maybe how we can help manage those feelings. So while empathy is not, or excuse me, while empathy is important for clinical work, if it's not managed properly, it can lead to burnout. So I'm sure a lot of you, if not most of you, are familiar with what burnout means, but just to provide a common definition. So burnout refers to emotional exhaustion, depersonalization, and reduced personal accomplishment in response to job-related stressors. And the research on this suggests that burnout is actually inversely associated with empathy, where greater burnout is related to a decrease in empathic feelings toward the individuals that we work with. We can also experience compassion fatigue or empathy fatigue. Another common phrase being compassionate fatigue, or pardon, compassion fatigue, that I'm sure a lot of you are familiar with. Empathy fatigue is something that's defined by Stebnicki in 2007. And Stebnicki describes it as a state of emotional, mental, physical, and occupational exhaustion that occurs when a mental health professional is drained from interactions with their clients. Professionals suffering from empathy fatigue have a decreased ability to listen to and respond empathically to their clients. And it is also suggested that empathy fatigue is a precursor to burnout. There's also something called secondary traumatic stress that mental health professionals can experience, and in particular, forensic mental health professionals. Now, secondary traumatic stress is separate from vicarious traumatization. So vicarious trauma is something that is experienced by clinicians when they're working with people that sometimes can change our attitudes and our perspectives and our beliefs about the world, where secondary traumatic stress is actually more similar to PTSD, and it's experienced more acutely than vicarious traumatization. And it can happen when individuals are working with people who have experienced traumatic events, and then by the provider or the mental health clinician, evaluator, whatever your role might be, experiencing said traumatic event secondarily to the person that they're working with, they can actually start to develop symptoms that mirror PTSD. I wanted to discuss an article by Goldenson and Gutiel from 2023, where they actually identify forensic mental health evaluators' unprocessed emotions as an often overlooked form of bias. So how our emotions involving empathy can actually serve as a biasing agent in our forensic work. So there are different types of biases that influence our forensic work that I'm sure a lot of you might be familiar with. So things like confirmation bias, things like adversarial allegiance. This talk is too short to go into all the different types of bias that we might experience, but those are some pretty common ones. And I like this article because it explores, again, how our feelings involving empathy can also serve as a form of bias. So I like this particular quote from the article. FMHE refers to forensic mental health evaluator. And the authors say that forensic mental health evaluators may be distinctly at risk for vicarious trauma owing to their exposure to highly traumatizing material as part of forensic mental health assessments. So because when you're doing forensic work, you're often working with material that might be more emotionally upsetting, maybe more traumatic, maybe even above and beyond maybe other types of clinical work, that puts forensic mental health evaluators at a greater risk for vicarious trauma. Emotions of forensic mental health evaluators can influence the evaluation interviews and subsequent data collection. So evaluators' feelings and the way that we feel toward the person that we're interacting with can influence our interaction with them and then subsequently our ability to collect data. The authors discuss this from a lens of often discussed in psychodynamic theory, transference and countertransference, for example. Is transference and then resulting countertransference from the evaluator that's present in the room influencing the way those dynamics that we have when we're interacting with the individuals that we're evaluating? And is that countertransference interfering with our objectivity and with our subsequent data collection? The authors also talk about how empathy and transference versus countertransference, for example, might come into play, not just with the individuals that we're directly evaluating, but also with other individuals we're working with. They provided a good example of work with an attorney, for example. Is an attorney and their perspective and the way that they're interacting with the evaluator, possibly some pressure they're putting on the evaluator, for example, in terms of what the evaluator is indicating in their report, is that influencing the way that we are writing our reports and information that we are including or excluding in our reports as a result of the feelings that those dynamics are creating within us? The authors stress some ways to kind of counter the bias that might be present as an influence of our emotions and our empathy in several different ways. So they stress the importance of self-reflective practice in forensic mental health evaluations and emotional reflexivity. So being able to have an awareness of our emotions during evaluations and during interactions with other individuals that we work with during the course of our work, attorneys, judges, other legal professionals, for example, et cetera. They also recommend psychotherapy as a way to address not only how our emotions are affecting us and what that means for us personally as individuals during the course of our work, but also how those emotions are coming into play in the room when we are at work. And the other thing that they recommend as a method of controlling such bias is professional consultation with others as well. And one thing I really like about this article is the authors also talk about the importance of being honest and having honest conversations about the way that we're feeling and not feeling like we have to inhibit discussion or addressing our emotions for fear that we're going to come across as unfit as a forensic mental health professional, or maybe too sensitive, for example, or unprofessional. And they stress the importance of being able to have these candid conversations, because we are human beings and we are working with things that are going to affect us emotionally and potentially in turn affecting our work. So I will get into our second objective. But to get to that objective, I want to first discuss how the effects of empathic expression on examinees functions, because that is what ultimately led to the discovery of how empathy can affect evaluators and our impressions in our work. So to express or inhibit empathy, that is the question. I put this here because this is a topic, the whole way that this empathy topic came up for me was because over the course of my training, depending on the setting that I was in, I had supervisors that encouraged the expression of empathy. So for example, that was largely encouraged when I was in settings where I was working with individuals who were either staying somewhere for inpatient psychiatric services, or they were involved in intensive outpatient services. I had one supervisor in particular who was wonderful, and he really helped encourage us as trainees to use our empathy as a tool in the room to help us build rapport and convey to the patients that we work with that we care about, we respect them, and to provide kind of that safe space for them to engage in a therapeutic alliance with us. When I was in other settings, for example, settings where I was administering neuropsychological evaluations, in those types of settings, I was encouraged to inhibit as much as possible this kind of expression of empathy or this engagement in conversation with the individuals I was evaluating, in effort to not disrupt the evaluation process and the administration of the evaluations and the data I was collecting. So when I first came to UNM as a forensic psychology postdoctoral fellow, I had asked my supervisor, Dr. Perillo, how do you recommend I approach my work here as a fellow and with the individuals that I work with? And he said, hey, why don't you look into that? And there's some good research on it, and we can talk about it. But in short, empathy, it's a delicate balance between using it in such a way that it conveys to the people that we are working with appropriate respect and an interest in them, and as a way to build an alliance and to gather information, but not going so overboard that you're being maybe crossing lines in terms of boundaries or being unprofessional or exploitative. So first I want to discuss a quick or brief, as briefly as possible, a seminal paper that was written by Daniel Schumann in 1993 concerning the use of empathy in forensic examinations. So Schumann expressed some concerns. So one of the concerns was that the forensic examinee has a misinterpretation of the relationship with the individual that's evaluating them, and might perceive that relationship to be more of a therapeutic alliance versus evaluator and examinee. And subsequent to that misinterpretation of a therapeutic relationship, there is a concern that the examinee then discloses more information than they otherwise would if they didn't perceive a therapeutic relationship. And in turn, ultimately, the concern there is that the forensic examinee might disclose more information than they otherwise would have, and in turn risk violating their Fifth Amendment right to avoid self-incrimination. Often the topics that you're discussing in forensic evaluations are medical, legal, or psycholegal concerns. And there is a, we want to be careful not to include information in our reports, in the work that we produce for the courts, that might be incriminating for the individual. So that's kind of the basis of some of these concerns that Schumann highlighted. So Schumann pointed out that even though we provide informed consent during forensic evaluations, we provide a warning to the limits of confidentiality. Schumann argued that this is simply not enough, because individuals who are moving through the legal system often have factors that are perhaps unique to the legal system? Not necessarily, but we do tend to see a lot of things like trauma histories. We see a lot of that. We see things like just the stress of, pardon allergies again, just the stress of moving through the legal system in itself is traumatic and stressful. That in turn might create an increased need for this individual to have trust and confidence. They are perhaps isolated from social things. There's a lot of stigma involved. They might not have people that they can turn to. So they might latch on to the forensic evaluator as a trusted confidant. So it kind of doesn't matter whether there's an informed consent or a warning to the limits of confidentiality, because their need to have somebody to talk to is so great. Schumann also pointed out a concern that due to the nature of our work and training as mental health providers, evaluators are become kind of second nature, skilled at helping people discuss uncomfortable topics. So whether we're conscious of it or we intend to or not, Schumann had a concern that even if we're being cognizant of keeping those boundaries in place between evaluations and maybe therapeutic work, we have a natural inclination to purvey through our language, through our as well as our body language, that people are safe discussing things with us that they might not otherwise be, and that might elicit an oversharing of information by the individual that we're evaluating. Schumann says in the abstract, empathy is neither positive nor negative. A therapist may use empathy to help a patient, and a car dealer may use empathy to sell a car. I like to include this quote because it struck me personally. I had always sort of conceptualized empathy as something that was altruistic, that was always good. I hadn't considered until I really kind of dived into this that empathy is just empathy. It's sort of neutral until you use it deliberately in a certain way. So some other concerns Schumann highlighted were the use of empathy in forensic evaluations is an ethical issue due to the involuntary relationship that is taking place during a forensic evaluation, kind of counter to a therapeutic relationship where you're meeting with an individual and you have a shared goal in therapy, and the patient or client, or however you refer to them in your practice, sort of drives their therapeutic goals, and the therapist becomes aligned with those goals. In a forensic evaluation, a court-ordered evaluation, a psycholegal evaluation, the relationship is less voluntary. Often these evaluations are ordered by the court, requested by attorney, things like that. The individuals that we evaluate don't always want to participate, and that we don't have the same shared common goals as you typically see in a therapeutic setting. So that covers the involuntary relationship, the lack of shared common goal. The limits to confidentiality also look different. So when we are working with court-ordered evaluations, for example, I function predominantly as a court-ordered evaluator at the moment. So all of my referrals are court-ordered. I do not have requests, private requests from attorneys. So that looks different. We have to explain to the individuals we evaluate at the offset, you know, in other settings, when people meet with psychologists or psychiatrists for treatment purposes, you're protected by things like HIPAA, et cetera. With court-ordered evaluations, because the court ordered this, the sort of this spiel that I give to the evaluees that I work with is not everything that you and I discuss is going to stay completely between us. The information that we discuss will be summarized and shared with the court. So the judge will have a copy of the court report based on our conversation. A copy will also be received by your attorney as well as opposing counsel. So notifying them that not everything is going to be completely confidential. There's also an adversarial relationship just naturally involved in judicial proceedings, and there is an influential capacity of the examiner on the proceeding. Brodsky and Wilson wrote a paper in 2013 kind of addressing some of Schumann's concerns. So I like to go over kind of the way that they address each of these concerns. So just really briefly, there are different types of empathy outside of just receptive and expressive empathy. There's also affective empathy, behavioral empathy, cognitive empathy, and expressive empathy, which we've already gone over. Affective empathy more refers to the emotional empathy. So those feelings of emotion that we share with the individuals that we're working with, that we can really sort of step into their shoes and feel emotionally. Behavioral empathy is more deliberate, and it's things like in this example here, it might give the impression that the evaluator is helping and for the evaluatee. If somebody's crying, for example, handing them a tissue, that's a form of behavioral empathy. And then cognitive empathy is when we can sort of how effective empathy is sharing emotions. Cognitive empathy is being able to mentally place ourselves in another person's shoes, but not necessarily also feeling that effective empathy. So mentally understanding what somebody's going through or feeling what they're thinking, and what they might be experiencing perceptually, but maybe not necessarily feeling the actual emotions and sharing those emotions with the person. I like to highlight expressive empathy here again, because that's a sticking point. Brodsky and Wilson say that therapeutic relationship building is not part of the forensic evaluation. So to address a concern about maybe somebody misinterpreting the evaluation as a therapeutic alliance, they address that by saying, we aren't doing the same level of relationship building and the same deliberate level of rapport building, spending as much time with the individual and really honing in that alliance as we are during a therapeutic relationship. They say that conveying respect for examinees is necessary and crucial for competency and ethical practices. I personally agree with that. I think that we are human beings at the end of the day working with other human beings, and despite what the situation is or the context is that we're working with them in, or the legal question that we're answering or whatever information we're trying to gather, we're human beings, all of us at the end of the day. And I think it's really important that we help them understand that we have a basic respect for them. Like in research studies, you can remind examinees that they can opt out of the evaluation at any time. So if there's a concern that they feel like they have to stay in that evaluation and they have to disclose information, just reminding them that, if that concern comes up during the evaluation, you don't have to continue. So for example, one way that I address this in my evaluations, and I mostly work with, at least in the criminal arena, mostly work with criminal competency evaluations. So I'll say at the outset during the informed consent process, now I'm going to be asking you a lot of different types of questions today. It is your legal right not to answer. So letting them know that they're not mandated to answer every single thing if there is a concern. And I've had instances where someone is willing to engage in the evaluation, and halfway through or at some point through, they withdraw their consent, and that's fine. It's just like with research, they're not forced to sit there and answer every single question. Brodsky and Wilson say it makes no difference. And what they mean by that is whether you're deliberately and verbally expressing or making empathic statements or engaging in behavioral empathy, it essentially doesn't matter in terms of potentially influencing the examinee in a way that might lead them to divulge more information, because most of our communication anyway is nonverbal. They say that a measured degree of expressed empathy might be acceptable and socially normative. And I agree with that. For example, if somebody comes in and says, or you're having a discussion, let's say, and you're asking about their family history and what does that look like? And, who did you live with in the home growing up? And they divulge something traumatic, like, I just lost a sibling last year, something like that. It's okay and actually quite appropriate to stop and say, I'm so sorry to hear that, and continue, as opposed to just sort of glossing over whatever they just said and sort of robotically carrying on. That might in fact lead somebody to not feel safe disclosing things and shut down, because to them, it's like, this person doesn't actually care about me or my experiences. So a measured degree of expressed empathy, again, might be acceptable. This was a personal communication to the authors from Domino in 2010 that said after 7 years of doing 100 plus evaluations per year, rarely has it happened that a defendant has revealed another criminal act. So basically saying maybe the concern that was posed about somebody violating their Fifth Amendment right to self-incrimination, maybe that's not so much a concern because in practice, maybe we actually don't see that as much. They say that not expressing enough empathy might lead to guardedness from examinees, thus affecting collection of crucial information. Back to the example of somebody maybe divulging something to the evaluator that's emotionally difficult for them. If they experience a coldness or like the evaluator doesn't care, again, it's kind of like, well, why even express these things that are difficult for me to talk about? This person doesn't care anyway. They might actually shut down a little bit. So, and forensic evaluators, we do have increased accountability for accuracy due to legal ramifications. You know, all psychological work is important. Our notes are important. Our reports are important. No matter what setting we're in, we have a fidelity to the individuals that we work with and to the science to do an appropriate job and to be accountable and to produce the best work product possible. But we do, once we get into the legal arena, there are other things and other considerations. These evaluations tend to have a pretty significant impact on the individuals being evaluated and the course and the results of that evaluation and what that might mean for them. The use of empathic questioning might assist in gathering more accurate information. So maybe somebody feels shame about something and they don't want to disclose it, for example. But then if they feel an empathy from the evaluator and they feel safe and comfortable sharing that information, then maybe they might say, hey, for example, substance use is often one that comes along with a lot of stigma and minimization of information. But if they feel like their evaluator is empathic towards them, they're not taking a judgmental stance towards them, maybe they'll be more honest about disclosing the substance use information, for example, or something else, trauma history, anything that might be a more difficult or that might carry more of a stigma with it. I like this quote that they use, so I like to end with this when discussing their paper. So they say that a manipulative empathy intended to break down the defenses of the evaluee, seducing him or her to reveal incriminating information, is a version of psychological trickery that contradicts the ethical principle of do no harm. As an example of the polar opposite of empathy, a manipulative, self-serving forensic assessor might act prejudicially against an evaluee as much as an assessor can behave inappropriately for an evaluee. They go over compassionate detachment, which is appreciating someone's feelings without sharing those feelings. So this is akin to that cognitive empathy that I discussed earlier. They also caution evaluators to take care not to slip into a healer role, whether you intend to or not. I noticed this during my postdoctoral training. I was shifting from an internship site where they largely do focus on evaluation at the site I was at, but we also did intervention work as well. So I was sort of used to functioning as both or being able to kind of change hats depending on what I was doing. So to go from being a healer in certain contexts into strictly an evaluator role was something that was a bit of an adjustment. And I had to get used to, I can think of one example in particular, somebody sharing something that was emotionally difficult for them. And I had to take care because I really felt for this person in the moment. And I had to check myself mentally and take care not to dive into, I'm so sorry to hear that. Have you tried this intervention? Maybe we can get you linked up with this. Your emotions sometimes can kind of take hold and almost start to lead you down that healer path that some of us become accustomed to. So you really have to be present in the moment and make sure that you are sticking to an evaluator, a data collection role versus naturally slipping back into that healer role. And they say a way that you can do this is that we should not be perceiving the people that we evaluate as patients per se. They discuss run-of-the-mill empathic expression versus over-the-top expression. So back to that example I said, where if somebody divulges that they lost somebody close to them, stopping momentarily and saying, I'm so sorry to hear that, and then carrying on would be appropriate, versus really going over the top with the expression. Oh my goodness, that must have been so awful. I don't know. You don't need to go into that level of expression. They also propose that there needs to be more empirical study on the subject, and they propose using empathy as a tool for effective human interaction. So other effects of expressed empathy on examinees, there are concerns that often the information that we elicit can be of a traumatic nature. So we want to take care not to elicit too many details, because we don't have time to close the wound, for example. You're not meeting with this person again, at least not for therapeutic reasons, more often than not, or you likely aren't. So you don't have time to meet with them again to make sure that anything difficult that was brought up for them that might serve to, even in extreme cases, destabilize the person's functioning, that you don't have time to go back and address that and close that up. One way that I kind of take care to address this particular issue in my evaluations is if I'm getting into a topic that might be particularly difficult. For example, if I'm about to ask the person about any childhood ACEs or abuse, neglect, anything specific like that, I'll often say, now I understand that these next questions or the next topic of conversation might be a little bit sensitive or emotionally difficult. Please don't feel the need to divulge anything in explicit detail. You can just answer yes or no if you're comfortable with that. You're also risking individuals being angry at the outcome of the evaluation. We are to remain as unbiased as possible, and as objective as possible in these evaluations. And sometimes that means forming opinions or, coming up with conclusions that are not, that the person you're evaluating is not going to be happy about. So that can happen, that they're not happy with you at the end of the day based on the results of your evaluation. So now we'll get into the effects of empathic expression on evaluators, which is more in line with our objective 2. So that came up, after this discussion about, well, how is the way that we're interacting with the evaluees in the room influencing them? Vera et al. Released this paper in 2018 called How Does Evaluator Empathy Impact a Forensic Interview? So the goal of the study was actually to examine evaluee levels of disclosure like we've been discussing. So their level of disclosure of information when the evaluators expressed empathy versus when they didn't. And interestingly, they had findings about not just how it affects the evaluee level of disclosure, but actually how these evaluations impact the evaluator themselves. So their main findings was that a sense of alliance between evaluee and forensic examiner does not necessarily affect the levels of evaluees, or excuse me, the level of evaluee disclosure. And their most striking finding was that expressing empathy seemed to influence the evaluator's perceptions of examinees. So when using expressive empathy, the evaluators rated examinees as less psychopathic, more conscientious, and more honest. Some context to this. So in terms of this article, they used an experimental design that was to examine the effects of expressive empathy on both evaluees and evaluators for psychopathy assessment interviews. And the reason they did that was because psychopathy assessment typically involves an interview that elicits antisocial attitudes and behaviors, and therefore is ripe for the types of potential defendant disclosure about which experts have warned. So they used a simulation study that used doctoral students with forensic assessment training and evaluation experience as forensic evaluators, and they used undergrad students as evaluees, in part because of the accessibility, but also in part due to concerns about using potentially manipulative interview techniques with individuals who are in fact justice involved. So the evaluees completed a self-report personality trait measure several of those, and were then randomly assigned to to be interviewed by either an evaluator who was instructed to express empathy or an evaluator who was instructed to inhibit empathy. And the primary outcome measures were the evaluee's willingness to admit to past instances of misbehavior during the interview, their self-reported use of impression management during the interview, and evaluators' ratings of evaluee psychopathy and related traits. To control for evaluator-specific effects, the researchers actually had the evaluators administer evaluations in both conditions. So the same evaluator for some evaluees would express empathy, and for other evaluees, they would inhibit empathy. They say that the current study shows that the same evaluator can view the evaluees differently because of a purposeful decision to conduct the evaluation one way as opposed to another. So among evaluators, the same evaluators, just depending on what condition it was that they evaluated the person in, they found similar findings. This is a quick table that you're welcome to see for time purposes. I won't go into detail, but you'll have access to the slides and you can look at that. They discuss, again, this detached concern. So it's a concept that was largely studied in medical practice. And again, it's intended to function as a means of both limiting and managing a provider's emotional distress and for safeguarding that objectivity. So using our thoughts to sort of mentally place ourselves in the shoes of the individuals we're evaluating, but not necessarily letting us get swept away by the effect of empathy that might be elicited during interactions. They say that detached concern allows us to continue to use empathy as a tool for getting at the truth, both historical and narrative in evaluative work, while avoiding, again, over-identifying with the people that we're working with and that influencing our clinical judgment. In terms of ethical considerations in concerning empathy in forensic work. So first I'll go over principle A. So as forensic clinicians, we do have competing roles. Does the duty to judicial process conflict with non-maleficence? So can our obligation to the judicial system, for example, so for example, for court-ordered evaluators, or any forensic evaluator, really, our client becomes the court, right? Or the individuals who have hired us to answer a question for them. It's not necessarily the person that we're evaluating. And in fact, the person that we're evaluating, depending on the outcome of the evaluation or the situation, has potential to be harmed, right? So let's say, for example, there's a competency evaluation. This person is found incompetent. Depending on what state you're in, let's say they're sent for competency restoration somewhere in a setting that's not comfortable for them, and that might, in fact, increase their distress. That might lead to psychological distress, lead to harm for the individual, but we cannot change our opinion because we have those concerns. Our fidelity is to the science, to our client, to the court, to answer that psycholegal question in an objective manner, regardless of, unfortunately, maybe the outcome for the patient that might not be favorable for them. So principle B, fidelity and responsibility. Can the ramifications of expressed empathy impact our principle of fidelity and responsibility within the forensic arena? So for example, does empathy affect our willingness to fully comply with this principle if we are overly concerned about the outcome the evaluation has on the individual, to the extent that we're not maintaining fidelity and responsibility to the judicial system and to the community at large? There's also standard 3.06, which is conflict of interest, that states psychologists refrain from taking on a professional role when personal, scientific, professional, legal, financial, or other interests or relationships could be reasonably expected to, number one, impair their objectivity, competence, or effectiveness in performing their functions as psychologists, or expose the person or organization with whom the professional relationship exists to harm or exploitation. So same concerns here. How is our role as a forensic evaluator when we consider all of the things that go into that and the outcomes of the work that we do? just thinking about that and sitting with this standard, what are some conflicts that come up for you? Guideline 2.04 gets into the knowledge of the legal system and the legal rights of individuals. So it states that psychologists refrain from taking on a professional role when similar to the last standard that other interests or relationships could reasonably be expected to impair our objectivity, our competence, our effectiveness in performing our functions as psychologists, or that might expose somebody to harm. So, in conclusion, and I love this quote by Sledge, there is no way that a human being can be a forensic psychiatrist, or for that matter, any kind of examiner of the human condition or a mental health professional without having emotional reactions. To do so would not be human. However, what the professional in these circumstances can do is learn how to recognize his or her own patterns of response and be able to understand how these particular responses enhance or impair objectivity, neutrality, or the elucidation of the truth. At the end of the day, we're human beings ourselves working with other human beings, and we are going to have emotions about the things that we hear, the things that we read, other people's experiences. And based on our own personal histories, that might also affect our levels, our dynamics in the room. That might also affect our levels of burnout, et cetera. And that is why in that paper that I mentioned at the beginning, those authors really stress, psychotherapy potentially as a way to address issues that empathy might bring into our working relationships, because we all come from different backgrounds. We all have different experiences that are going to influence our feelings depending on the subject matter that we're working with. And that is all that I have today. So here's the evaluation link QR code that will also be put in the chat as well. And then I'm happy to open it up to any questions that anybody might have.
Well, thank you so much, Dr. Brown, Cassie, for going over that. I can attest to the thoughtful consideration you put into your evaluations and how you approach the people that you are discussing things, and the considering the implications for how you present, how it'll affect the dynamic and the dialogue with the people that we're evaluating. So really appreciate you thinking of this perspective and sharing it with everybody else here. We do have some questions already. For those of you that do have additional questions about empathy or to Dr. Brown, feel free to enter those in the Q&A box anytime that you would like. This on the screen, the QR code is for the survey that you can complete. The chat box in the next couple of minutes should have the link, the direct link for the CEU survey. I don't have that on hand, but our administrative staff who does come on, they will post that in the chat box there very shortly. So thank you for that. Somebody asked about a particular situation they had very recently. First of all, saying, welcome from a fellow DSH doctor. Today, they had a patient that was inconsistently reporting the case against them as strong, but that in a fair trial, believed they would have a 100% chance of being exonerated. Some on the team characterize this as anti-authority posturing. Some think it's psychotic non sequitur. Can any evaluator avoid using their own existing prejudices to decide how to characterize a situation like this?
Yeah, that's a really good question. So I think if I'm understanding the situation correctly, it sounds like there's people on the team that have different perspectives about this individual's um, it sounds like motivation for.
The vibe, what I'm getting here is that we have a couple of people on a team that are interpreting a perspective as perhaps psychosis, and
Okay.
some that are saying this is more of a general anti-authority
Mm,
rebellion, more of a personality kind of thing. And that perhaps this is the product of our own differences, of how our own biases of how we tend to see things. Um, can an evaluator reduce or avoid those kinds of existing prejudices, and how to characterize what they're hearing from somebody?
good question. Yeah. So I think as human beings, it's impossible to avoid all bias. We've already, especially as adults, had so many experiences that shape our perception that we're not even actively and consciously aware of, right? So I don't think that that can necessarily be avoided. I think that our perspectives and really shape that lens often. So what's important here, though, is recognizing that it's possible, right? That our perspective, our levels of empathy based on what we've experienced, um, are going to influence how we are interpreting information, interpreting presentations of clients, patients, et cetera. So I think the important piece becomes not how do we avoid it, because it's likely that that's happening whether we realize it or not, but understanding that this is a potential area of bias. This is a potential area that's influencing my conceptualization of this person that I'm working with. So how can I address that? And I think the big things, and as authors have pointed out in literature I discussed, and also just what I know from working my way through this system, even though I'm still early career and I have a long way to go, is really honing in those self-reflective skills and not being ashamed to say to yourself, okay, where am I feeling this? How am I feeling? What connection might this be stemming from, or what experience? And is it possible that I'm perhaps wrong about certain aspects of my conceptualization? And this is a result of my own, whether it's countertransference or not, just something based on your own feelings. Also, not to be ashamed to ask for professional consultation with a colleague, a supervisor, a trusted other in the field, and say, hey, do you mind if I bounce this off you? I know, for example, recently I had a situation with a evaluation I did. It was a pre-employment evaluation for Albuquerque Police Department, and something came up in the interview, and I asked to consult with a colleague because I said, I don't know if this came up for me because I should be concerned about it in this particular instance, or if because the thing that this person said is personally kind of a sticking point for me and something that bothers me. So I would say being aware, being open to consultation and being honest with yourself. And then again, psychotherapy is not a terrible idea for practitioners, right? Because even though we are often psychotherapists ourselves, we're also humans with emotions and things that affect us, and we all have blind spots. So being able to be open to participating in psychotherapy ourselves, so maybe we can explore the ways in which maybe our past experiences are currently affecting us in our work that we might not even realize, I think is a great idea.
Wonderful. Thank you for that. I'll alert people that the link for the CEU survey is in the chat box. We have confirmed it is active and does work. If it's not working for you, I encourage you to bookmark it later, copy it later, perhaps open it in a different browser. But it is active and working. Somebody brought up a scenario in their career as a forensic nurse where they uh, would contact nursing staff at the jail to let them know if they had perceived an examinee was, in their description, floridly psychotic and threatening. It can be challenging to avoiding the healer role. I guess in considering a question here that springs forth in terms of empathy, as an evaluator, what are your considerations or thoughts in terms of that kind of more institutional disclosure to institutional staff if you are concerned about somebody that you have evaluated, if you're concerned about their overall mental health? Say they appear very distressed during your evaluation. What are the roles or limits that you would consider in terms of discussing that with the rest of the institutional staff that would be interacting with them?
Yeah, so I think that gets at something a little bit different. So I actually in institutional settings, for example, if it's a safety concern, if you're afraid that the person might harm themselves or harm others on the unit, or not even just physical, if you're scared that maybe they're expressing things that are warning signs that they might decompensate a little bit more or have some kind of a more of an intense reaction to something. I think if it's in the purposes of safety and not just physical but psychological safety, it's okay on an as needed basis to disclose things that you or to discuss your concerns and the basis for your concerns with the rest of the treatment team or with individuals on the floor in the day room, for example, that might be interacting with somebody that might need to know this information for those purposes, I think that would be fine. And whether that concern stems from maybe it's possible that there's a misperception based on your own experiences, et cetera, and so on. I don't think that should matter for purposes of institutional interaction, treatment, safety, whatever's best for the client in the unit, as long as you're not, going around to the rest of the treatment team or other staff on the floor and saying, hey, this was weird. Like, I just want to talk about it to get it off my chest because I'm having a reaction. If it's truly for purposes of treatment and safety for everybody, then I think it's fine, even if it's based on maybe a feeling that you're not sure is consistent with what you're actually seeing or not.
Sure. And how would this apply to the administration of psychological tests? This person says it would seem that some measures that are administered are designed to identify characteristics that the respondent might not want to reveal.
Yes, that's very true. And there are often questions that would elicit or that would pull for information that people are not comfortable revealing for whatever reason, whether they think it's going to get them in trouble or whether they're ashamed or it's stigmatizing. Um, so I think that when we are administering measures um, that are designed to pull for such information, I think it's important that you can appropriately and professionally, of course, help the individual feel comfortable. So it's okay to have a little bit of that behavioral empathy. It's okay to make empathic statements that, again, are appropriate, not over the top, professional, to help them understand that, yes, you're there for a purpose, and in forensic context, quite often a legal purpose, but you as an individual are not there to judge them, to discriminate against them, to make them feel um, unsafe. And I understand that can be tricky depending on the person and the context and other things that they're dealing with, their presentation, their thoughts, all of those things. But whatever you can do in the moment, at the outset of the evaluation, throughout the evaluation, to let them know that they are safe with you, psychologically and emotionally, that can help kind of promote maybe more openness to having those conversations that are more uncomfortable.
Sure. Someone said that they've noticed at their institution that they're asking more and more identity-based questions of the people they're evaluating, such as gender identity, sexual orientation, religious preference, in addition to more traditional age, sex, race that have been frequently asked before. Do you think there's a place for evaluators disclosing their detailed identity statement so that evaluees would understand biases that they may be subjected to?
Yeah, I'm wondering if the person who posed that, do you mean like disclosing parts of your identity so they might feel more comfortable in the room with you, like a shared?
I think that would be a part of this. I think their central question here is about, we ask a lot of identifying information about evaluees.
Okay.
What are your perspectives on the evaluator disclosing their own identity? Perhaps
Mhm.
for empathy perspectives, perhaps for information so that the evaluator knows the lens that the evaluator is coming from. What just in terms of your thinking about empathy and its impact on the evaluation. What are your perspective
Sure.
on this proactive evaluator sharing of their own identity?
Sure. I actually think when done appropriately and conservatively, as the case may be, it can be a useful tool. The things that you want to consider if you are going to share pieces of your identity are safety, first of all. So you don't want to share information that might compromise your safety. So like very specific details about anything from family to where you live to whatever, that might lead to somebody able to find you on social media or know where you live. So you want to always have safety in mind. You also don't want to divulge so much about yourself that it almost gets into a place where you're kind of stepping over that boundary and blurring the lines between professional behavior and more of maybe a personal relationship. You also want to be careful that you're not divulging so much that it almost leads the other person to feel like they need to be responsive to you based on what you share. and provide you some kind of, I don't know, empathy or whatever. Uh, but I do think it can be appropriate. So, for example, I was interviewing an individual recently, and this was for a civil forensic evaluation, and they were quite uncomfortable and like really nervous in the room. And I got to a question where I was like, oh, well, what do you like to do for fun? And they said they like to, or no, I was asking about what discipline what looked like for them growing up. And they were like, oh, well, I really like entertainment, TV, video games, etc. So those would be taken away. And I said something to the effect of, oh yeah, my nephews they love their video games. And so, my sister takes those away for them and then they relaxed more, they laughed, and they were able to kind of like engage in more conversation. So I think light disclosure like that, or something that helps them feel like you understand them on maybe more of a personal level without getting overly descriptive, I think is useful and fine.
Cassie, Dr. Brown, thank you so much for sharing your thoughts here, and all the literature that you've pulled here about considerations for empathy that we can consider as we do our own evaluations. It is much appreciated, and yes, thank you for sharing all of that with us today. That wraps up this week's Law and Mental Health series. We hope to see you next time when Dr. Miguel Nunez and Dr. Andrea Musket will be discussing insights into violence risk assessment from a multidisciplinary treatment team perspective. We hope to see you then for another great discussion of issues in behavioral health and the law. Until next time.